When talking to patients about type 2 diabetes, as pharmacists, it's important to make sure that the counseling is comprehensive but not overwhelming. And what I mean by that is there's a lot of aspects to diabetes care, especially with type 2 diabetes, that patients will have to take into consideration. So, for example, medication adherence is one. Others include immunizations, self-care management skills. And so there's a lot of different things that are going to be important. But again, it's important to make sure that pharmacists don't overwhelm that patient. Sometimes the patients could have just received a diagnosis of that condition. They know very little. So it might include just explaining to them as to what's happening with their body and why they may be on one or two different medications to treat the same condition. Sometimes just explaining how a drug works makes a big impact because they now understand why they're taking that drug. For example, it could be an oral pill or an injectable, and sometimes they may not understand the differences and why some patients or friends of theirs are on oral medication versus an injectable. And so that impacts, again, adherence and persistent rates and making sure patients understand what they're doing. The other things are a lot of lifestyle and behavior changes. So with any chronic condition, it's important to talk to patients regarding lifestyle changes that can make. And so from a pharmacist standpoint, that could involve things such as smoking cessation, if that's applicable, proper amounts of alcohol intake, nutrition, exercise are some examples there. And then other self-care management items that would be on that list are proper foot care, proper immunizations, as I mentioned earlier, and then treatment of hypoglycemia and what to do in those emergency situations. And so again, there's a lot of different things, but it's a relationship that the pharmacist and that patient are going to have and build on. So again, it's in the beginning, it's what do they need to know today, and then what are things that I can talk to them as this relationship kind of builds.
The microvascular complications associated with type 2 diabetes include proliferative retinopathy, nephropathy, which involves the kidneys and loss of protein and irreparable damage, and peripheral neuropathy. Peripheral neuropathy is kind of interesting, though, because there's two different types. You have one that we call painful neuropathy, and then another one, which is what we call position-sense neuropathy. The macrovascular complications associated with type 2 diabetes and type 1 diabetes is centered on heart disease, increased risk for myocardial infarction, cardiovascular death, and stroke. So tight glycemic control is advocated because in the long term, the microvascular complications tend to progress a little bit slower in those that exhibit tight glycemic control. Likewise, tight glycemic control may impart not a short-term benefit on macrovascular risk reduction, but perhaps a legacy effect can be seen many, many years later in those that are more intensively treated.
The way that I work and the clinical capacity that I have is in a multidisciplinary team. And so we know that when it comes to managing a patient with diabetes, that it's going to require a lot of time and effort and resources. So I always joke around and say that it takes a village to manage a patient with diabetes. And the reason being is, if it was just an endocrinologist or a primary care that could treat and solve, a lot of the issues that we have with diabetes, it wouldn't be in the current state that it is. So we need kind of all hands on deck. And so in my clinic, the way that we have it integrated is we have 3 endocrinologists, a nurse practitioner, and myself, and we work with our primary care colleagues to kind of take referrals and consults from them because we realize that there's a lot on their plate. And so we try to focus on their endocrine-related or diabetes-related matters. But again, it's making sure that you have a multidisciplinary team, or at least if you don't have access to a team in all situations, it's making sure that you care coordinate some of those services. And so we don't have a nutritionist or dietitian that sits directly in our team, but we make sure that they're aware of the treatment plans they're being referred to, and the same thing goes for the pharmacist. So you might be helping the patient make an appointment with one of the specialists. It's important to kind of care coordinate that back to their provider if there's medication changes. If you notice that there's a certain medication that their patient's no longer taking because of an adverse reaction that they've informed you about, these are all important things that you need to let the entire team that's managing that patient and that patient's condition know.